SQSTM1 mutation is the cause of familial and sporadic on patients with Paget's disease of bone. This gene encodes for the sequestosome 1 protein, also known as P62, that is expressed in most tissues, including bone. The exact molecular mechanism of SQSTM1 mutations is unknown and not well understood. Environmental triggers may have caused the disease as suggested by the focal nature of skeletal lesions together with the incomplete penetration of the disease among family members and the decline of prevalence rates. Other environmental triggers for Paget's disease of bone mainly include biomechanical factors, smoking, low dietary calcium intake or vitamin D deficiency, and occupational exposure to toxins. Since in Paget's disease of bone the increased rate of bone resorption remains coupled to a parallel increase in bone formation, it is sufficient to suppress osteoclast activity and bone resorption to restore bone remodeling rates toward normal. Antiresorptive agents are the treatment of choice for this disorder. Calcitonin is the first effective therapy of Paget's disease of bone, rapidly superseded by the bisphosphonates because the effects of calcitonin on biochemical activity and the relief of symptoms are incomplete and short-living. Bisphosphonates and particularly nitrogen-containing bisphosphonates actually represent the treatment of choice of patients with Paget's disease of bone. A recent Cochrane review confirmed the greater efficacy of nitrogen-containing bisphosphonates versus non-nitrogen-containing bisphosphonates in normalizing ALP in patients with PDB. Zoledronic acid is actually the most potent and effective nitrogen-containing bisphosphonate. It is available in most countries for the treatment of the disorder. This compound shows the highest antiresorptive potency together with a longer-term retention in bone.